Etomidate. Expanded lecture notes. Etomidate is a short-acting intravenous anesthetic agent often used for induction of general anesthesia, particularly valued for its minimal impact on cardiovascular function. Etomidate is an IV anesthetic for induction. Good for heart patients because it doesn't affect blood pressure much. Pros. Stable for heart means it doesn't cause big changes in blood pressure or heart rate. Fast, works quickly for induction. Cons. Affects adrenal glands, can suppress how adrenal glands work, which is important for stress response. Hurts when injected. Some patients feel pain when etomidate is given through the vein. Introduction to Etomidate. 1. Etomidate is a short-acting intravenous general anesthetic known for providing rapid induction of anesthesia with minimal cardiovascular and respiratory depression. This means it quickly puts patients to sleep for surgery while causing little impact on heart and breathing functions. 2. It is especially valuable for patients with limited cardiac reserve, making it a preferred choice in hemodynamically unstable patients during induction. Patients with weak hearts or unstable blood pressure benefit from Etomidate because it doesn't stress the heart much. Definition of Etomidate. Etomidate is an imidazole-derived sedative hypnotic used primarily for induction of anesthesia and sedation in critically ill or unstable patients. This means Etomidate is a type of medicine that puts patients to sleep for anesthesia or sedation, used mainly for very unstable patients. It produces unconsciousness rapidly, with minimal effect on heart rate, blood pressure, and myocardial contractility. Etomidate quickly makes patients unconscious while causing little change to heart rate, blood pressure, or how strongly the heart contracts. Classification of Etomidate. 1. Pharmacological class. Intravenous general anesthetic. This means Etomidate is a type of medicine given through a vein to induce general anesthesia. 2. Chemical class. Imidazole derivative. Etomidate is made from a chemical structure based on imidazole. 3. Therapeutic class. Sedative hypnotic agent. Etomidate is used to calm or put patients to sleep for medical procedures. Chemical properties of Etomidate. 1. Chemical name. R plus ethyl 1 phenylethyl minus 1H imidazole 5-carboxylate. This is the full chemical name of Etomidate. 2. Molecular formula. CHNO. This shows the elements and number of atoms Etomidate. 3. Molecular weight. 244.29 grams per mole. This is the weight of one molecule of Etomidate. 4. Structure. Imidazole ring with ester group. Etomidate's chemical structure includes an imidazole ring and an ester part. 5. pKa. Approximately 4.2, exists in water-soluble form at acidic pH, lipophilic at physiological pH. Etomidate's solubility in water or fat changes with acidity, it's more fat-soluble at normal body pH. Physical properties of Etomidate. 1. Appearance. Clear, colorless solution or milky white emulsion, depending on formulation. Etomidate can look clear or milky depending on how it's made. 2. Solubility. Water soluble at acidic pH, lipid soluble at physiological pH. Etomidate dissolves in water in acidic conditions but is more fat soluble at normal body pH. 3. Stability. Sensitive to light, store at room temperature. Etomidate breaks down in light, so it should be kept at room temperature. 4. Formulation. Often supplied in propylene glycol solution, which can cause injection pain. Etomidate is often mixed in a propylene glycol solution, which might cause pain when injected. Mechanism of action of Etomidate. 1. Enhances the activity of GABA gamma-aminobutyric acid at the GABA-A receptor. Etomidate boosts the effect of GABA, a chemical that calms brain activity. 2. Increases chloride ion influx leading to hyperpolarization of neuronal membranes leading to CNS depression. This causes brain cells to become less active because of increased chloride entering cells, making them less likely to send signals. 3. Produces hypnosis and anesthesia but no analgesic effect. Etomidate puts patient to sleep for anesthesia but doesn't reduce pain. Pharmacokinetics of Etomidate. 1. Onset, 30 to 60 seconds, rapid brain uptake. Etomidate starts working quickly in the brain. 2. Peak effect, approximately 1 minute. Etomidate's effect is strongest about 1 minute after given. 3. Duration, 3 to 10 minutes due to redistribution. Effect wears off in minutes as etomidate moves out of the brain. 4. Distribution, highly lipophilic leading to rapid CNS penetration. Etomidate is fat-soluble so it quickly gets into the brain. 5. Protein binding, approximately 75%. Most etomidate attaches to proteins in blood. 6. Metabolism, hepatic and plasma esterases, hydrolysis. Etomidate is broken down by enzymes in liver and blood. 7. Elimination, excretion of inactive metabolites. Broken down parts of etomidate leave body through urine. 8. Half-life, 2 to 5 hours. It takes 2 to 5 hours for half of etomidate to be removed from body. Pharmacodynamics of etomidate. 1. Produces rapid loss of consciousness without significant changes in HR, BP, or cardiac output. Etomidate quickly puts patients to sleep without affecting heart rate, blood pressure, or how much blood the heart pumps much. 2. No analgesia, must be combined with opioid for painful procedures. Etomidate doesn't reduce pain, so painkillers like opioids are needed for painful surgeries. 3. Transient adrenal suppression due to inhibition of 11-beta-hydroxylase enzyme. Etomidate briefly stops part of adrenal gland function by blocking an enzyme, affecting hormone production. Clinical uses of etomidate. 1. Induction of general anesthesia. Etomidate is used to start general anesthesia. 2. Induction in hemodynamically unstable patients. Etomidate is good for patients with unstable blood pressure or heart function. 3. Rapid sequence intubation (RSI) in emergencies. Etomidate helps quickly put patients to sleep for urgent breathing tube placement. 4. Sedation for short procedures in high-risk cardiac patients. Etomidate is used for brief sedation in patients with serious heart issues. 5. Adjunct in electroconvulsive therapy (ECT). Etomidate can be used with ECT for treating certain mental health conditions. 6. Procedural sedation in unstable trauma patients. Etomidate sedates unstable trauma patients for procedures. Use of etomidate in ICU. 1. Occasionally used for rapid sequence intubation in unstable critically ill patients. Etomidate helps put very sick ICU patients to sleep quickly for breathing tube placement. 2. Not recommended for continuous sedation due to adrenal suppression. Etomidate isn't used for long sedation because it can affect adrenal gland function. 3. Useful when cardiovascular stability is paramount. Etomidate is helpful in ICU when keeping heart and blood pressure stable is most important. Use of etomidate in anesthesia. 1. Preferred induction agent for patients with poor cardiac function or hypovolemia. Etomidate is chosen for patients with weak hearts or low blood volume because it doesn't stress the heart. 2. Used when maintenance of BP and myocardial function is critical. Etomidate is used when keeping blood pressure and heart function stable is very important. 3. Often combined with opioid, e.g., fentanyl, to provide analgesia. Etomidate is often given with painkillers like fentanyl because etomidate doesn't reduce pain. Use of etomidate in emergencies. 1. First-line induction agent for rapid sequence intubation in shock, sepsis, major trauma, or severe cardiac disease. Etomidate is often used to quickly put unstable patients to sleep for breathing tube placement in emergencies. 2. Used in prehospital and emergency department settings for unstable patients. Etomidate is used in emergency settings like ambulances or ERs for very unstable patients. 3. Avoid in septic shock if prolonged adrenal suppression is a concern. Etomidate might be avoided in septic shock patients if worrying about its effect on adrenal glands for a long time. Administration and dosage of etomidate. 1. Induction of anesthesia IV adults. 0.2–0.3 mg per kilogram IV bolus over 30 to 60 seconds. Etomidate is given quickly into a vein for adults to start anesthesia. 2. Elderly debilitated. Reduce dose to 0.15–0.2 mg per kilogram. Less etomidate is used for older or very weak patients. 3. RSI in emergencies. 0.3 mg per kilogram IV bolus. Etomidate is given in this dose for rapid sequence intubation in emergencies. 4. Follow with paralytic, e.g., succinylcholine or rocuronium. After etomidate, a muscle relaxant is often given for intubation. 5. Pediatric induction. 0.2–0.3 mg per kilogram IV bolus. Etomidate dose for children is similar to adults for starting anesthesia. Side effects of etomidate. 1. Pain at injection site common, due to propylene glycol. Patients often feel pain where etomidate is injected because of the propylene glycol it's mixed in. 2. Myoclonus, involuntary muscle movements. Some patients have twitching or jerky movements with etomidate. 3. Nausea and vomiting. Patients might feel sick or throw up after etomidate. 4. Hiccups. Some patients get hiccups with etomidate. 5. Transient changes in cortisol synthesis. Etomidate briefly affects production of cortisol, a hormone made by adrenal glands. Serious side effects of etomidate. 1. Adrenal suppression inhibits 11-beta-hydroxylase enzyme, can last 6 to 24 hours after a single dose. Etomidate blocks an enzyme in adrenal glands, affecting hormone production for up to a day. 2. Seizure-like activity, rare. Etomidate can rarely cause seizure-like movements. 3. Anaphylaxis, rare. Serious allergic reactions to etomidate are very rare. Contraindications of etomidate. 1. Known hypersensitivity to etomidate. Etomidate shouldn't be used in patients allergic to it. 2. Patients with septic shock requiring intact adrenal function. Controversial in one-time emergency use. Etomidate might be avoided in septic shock if adrenal gland function is needed, though this is debated for emergency one-time use. Precautions for etomidate. 1. Avoid prolonged infusion leading to risk of adrenal suppression. Using etomidate for a long time can affect adrenal gland function. 2. Use cautiously in patients with seizure disorders, may lower seizure threshold. Etomidate might trigger seizure in people with seizure disorders. 3. Consider pre-treatment with opioid or benzodiazepine to reduce myoclonus. Giving other medicines before etomidate can help reduce twitching movements. 4. Avoid known adrenal insufficiency unless benefits outweigh risks. Etomidate used in patients with bad adrenal gland function unless really needed. Advantages of etomidate. 1. Excellent cardiovascular stability. Etomidate keeps heart function and blood pressure stable. 2. Minimal respiratory depression, less than Propofol. Etomidate doesn't slow breathing much compared to other medicines like Propofol. 3. Rapid onset and short duration. Etomidate works fast and wears off quickly. 4. Ideal for unstable or shocked patients. Etomidate is good for patients with unstable blood pressure or in shock because it doesn't stress the heart. Disadvantages of etomidate. 1. No analgesic effect. Etomidate doesn't reduce pain, so painkillers might be needed. 2. Pain on injection. Patients often feel pain when etomidate is injected. 3. Myoclonus can interfere with some procedures. Twitches or jerky movements can happen and might affect some surgeries. 4. Transient adrenal suppression. Etomidate briefly affects adrenal gland hormone production. 5. Not suitable for long-term sedation. Etomidate isn't used for sedation over long periods because of adrenal suppression risk. Clinical considerations for etomidate. 1. Always combine with an analgesic if procedure is painful. Painkillers are needed with etomidate for painful procedures because etomidate doesn't reduce pain. 2. Use lidocaine to reduce injection pain. Lidocaine can help lessen pain etomidate is injected. 3. Monitor for adrenal suppression, especially in septic patients. Doctors watch for effects on adrenal glands in patients given etomidate, especially in sepsis. 4. Avoid continuous infusion in ICU. Etomidate isn't used for ongoing sedation in ICU because of adrenal suppression risk. 5. Consider alternative if patient is already on chronic steroids or has adrenal insufficiency. Other medicines might be chosen for patients with adrenal problems or on long-term steroid treatment. Comparison of etomidate with other agents. 1. Onset of action. Etomidate starts working in 30 to 60 seconds. Propofol works in about 30 seconds. Ketamine takes effect in 30 to 60 seconds. Midazolam takes 1 to 5 minutes to work. 2. Duration of action. Etomidate effect lasts 3 to 10 minutes. Propofol lasts 5 to 10 minutes. Ketamine effect lasts longer, about 10 to 20 minutes. Midazolam effect can last 1 to 2 hours. 3. Cardiovascular (CV) stability. Etomidate excellent stability for heart and blood pressure. Propofol can lower blood pressure somewhat. Ketamine can increase blood pressure and heart rate. Midazolam generally good for cardiovascular stability. 4. Analgesia pain relief asterisk. Etomidate doesn't reduce pain. Propofol doesn't reduce pain. Ketamine does provide pain relief. Midazolam doesn't reduce pain. 5. Adrenal suppression. Etomidate can cause brief adrenal suppression. Propofol doesn't cause adrenal suppression. Ketamine doesn't cause adrenal suppression. Midazolam doesn't cause adrenal suppression. 6. Injection pain. Etomidate often causes pain on injection. Propofol can sometimes cause pain. Ketamine doesn't usually cause injection pain. Midazolam doesn't usually cause injection pain. Conclusion on etomidate. 1. Etomidate is an excellent induction agent for hemodynamically unstable patients. Etomidate is great for patients with unstable blood pressure or heart function because it doesn't stress the heart. Etomidate offers rapid onset and cardiovascular stability. It works fast and keeps heart function stable. 2. However, its lack of analgesia and risk of adrenal suppression limit its role to single-dose induction. Etomidate doesn't reduce pain and can briefly affect adrenal glands, so it's mostly used once for starting anesthesia. Etomidate is particularly useful in emergencies and high-risk anesthesia cases. It's helpful in urgent situations or for patients with serious heart or blood pressure issues. Professional quote on etomidate. Etomidate is the anesthetist's shield for the failing heart, strong in the moment, but not meant for a prolonged battle. Emergency airway principle. Etomidate is like a protective tool for anesthetists when dealing with patients who have weak or failing hearts. Strong and helpful in the short term for getting patients through critical moments like intubation in emergencies. However, because of risks like adrenal suppression, etomidate isn't meant to be used for a long time or ongoing sedation. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.